I'm Vilma from UNICEF headquarters. And actually, I am presenting on behalf of my colleague, Dr. Simeon Nanama, who is unfortunately could not be with us. He is the regional advisor for West and Central Africa region. So today I will be presenting about the anemia situation in West and Central Africa and some of the steps that have been taken to address it. So where do we stand with vis-a-vis the anemia situation in West and Central Africa, and how are we faring vis-a-vis the World Health Assembly targets? Unfortunately, sadly, we are off track. And we're not there to reduce by half the number of non-pregnant women that are affected by anemia by 2025. We have seen an increase, actually, by 20% from 2012, from 45 million women to 54 million in 2019. So what are we doing to reverse this trend? We must understand why is there limited progress. We need to explore the reasons for stagnation. We need to consider contextual factors that are influencing anemia. And we really need to assess the interventions that are being implemented. Are they aligned with the etiology? Are they being done, or the interventions are happening in places where we have the high anemia prevalence? And also we need to use some insights to enhance program design and delivery. Next slide, please. So if we look at this slide, we see 3 different maps, which tells us about the situation among women in West and Central Africa. So we see that the prevalence across the region is quite widespread, but it's varying severity levels. So we look at countries like Nigeria, Gabon, Mali, Benin, and Cote d'Ivoire. They show extensive areas where any form of anemia exceeds 60% prevalence rate. That's quite high. Severe forms of anemia are particularly prevalent in countries located in the northwestern region of West and Central Africa. This analysis is based on the WHO hemoglobin cutoff points, the previous ones, not the updated ones. So basically, we see significant disparities when the degrees of anemia are being mapped. Next slide, please. If we take, we need to look at prevalence versus caseload, because this is really an important point. I mean, we might see high prevalence, but when we look at the caseload, oh, sorry, go back 1. Yep, thank you. Sorry, I'm not paying attention. Thanks, yeah. So it's really important to look at the caseload versus the prevalence, because prevalence indicates overall anemia rates at national levels, whereas the caseload highlights the subnational distribution and the case proportions. If we take the Ghana experience, in Ghana, anemia is significantly more prevalent along the coast, while a cluster of any, whether it's mild or moderate anemia in the northeast region, diminishes when considering severe anemia. So this fact underscores the importance of prioritizing areas with high caseloads in order to achieve the WHO targets, which is focused more on the total numbers of people with anemia. Next slide, please. Again, apologies, because I think the screens are too small to see, but this slide looks at the etiological factors, which we have been discussing over and over during this meeting. And This summarizes the evidence of factors that are contributing to anemia among women of reproductive age in West and Central Africa. If we look at the gray shading, the shaded area, basically it signifies the lack of any evidence regarding the anemia etiologies for each country. The regionally recognized factors that contribute to anemia include nutritional deficiencies, infections, contaminants, hemoglobinopathies, and a few others that we may not be aware of, but the ones that we are aware of are listed here. But one of the things we know that there's some significant gaps in data and in available information. This really signifies another message which has been reiterated over and over again in this meeting is that we need to do further research to understand the context-specific factors that are influencing anemia prevalence and its severity in the region. Next slide, please. So this graph is really important for this region because it tells us the hemoglobin concentration distribution across different groups. So we're looking here at non-pregnant adult women, non-pregnant adolescent girls, and pregnant women. What we see here is that the non-pregnant adult women bear the highest burden of anemia when compared to pregnant women, who have historically been our main focus for interventions. So what this slide is telling us that we really need to look at data carefully and not make assumptions, and therefore priority should be given to interventions that are tailored for non-pregnant women, with adolescent girls becoming as a secondary target group. And therefore, there's a need for a comprehensive package of context-specific interventions that extend beyond iron and folic acid supplementation, which is very typical for this target group, and then important to leverage other platforms for interventions beyond the health system. Next slide, please. So the question that we asked when we were looking at this data from West and Central Africa is that are we really converging the interventions on where the hotspots are of anemia are? So where do we see anemia and where are the interventions that are happening? So the two graphs here, they compare the prevalence of moderate and severe anemia with the composite coverage score of interventions. So despite the high anemia rates in these regions, interventions coverage is not sufficiently targeted. Intervention coverage, for example, includes some of the interventions include ANC, antenatal care services, 4+, iron folic acid supplementation, 90+ tablets, insecticide-treated bed nets, improved water access, and improved sedimentation. Whereas the areas with high prevalence of anemia, such as southern Mali, Benin, and Nigeria, do not consistently show high intervention coverage scores. Next slide, please. So how do we leverage other systems to address maternal anemia? So here we see detailed subnational data from Burkina Faso, which illustrates the varying caseloads of all types of anemia alongside the intervention coverage. Addressing maternal anemia effectively requires leveraging, as I said, multi-system approaches that encompass the food security within the food system, healthcare services. We need to improve not only the access, but also the quality of services and the type of services that are being provided. Improved access to safe drinking water, sanitation, and environmental health. So disparities are evident where areas with high percentage of anemia often have low intervention coverage. Again, this is the same story, which highlights the missed opportunities to achieve optimal coverage for anemia prevention and control. Next slide, please. I'm done. So based on all the data and the information from the various countries in West and Central Africa, UNICEF Regional Office has agreed to come up with a guidance to address maternal anemia in West and Central Africa. And some of these actions that are included in this guidance talk about that we need to prioritize. So it's important that we enhance national and geographical targeting where we have the high-risk populations and where our resources are constrained. It's important to generate more evidence on etiological factors to inform program design, implementation, and monitoring. Also important to leverage other systems beyond the health system, such as the food, the health, wash, and environmental systems to improve nutrition accountability and program coverage. And last but not least is to target the expand anemia control and prevention programs systematically to include and reach non-pregnant women and not just focusing on pregnant women. Thank you.